A title, Victim-Defined Advocacy. Ann Menard, CEO, National Resource Center on Domestic Violence.
I think at the core of victim-centered advocacy is the belief that victims and survivors should drive safety planning and decisions about their lives to the greatest extent possible. Our role as advocates, particularly when we're engaged in building a relationship, an individual relationship with a survivor, is to see the whole person, to see the violence and the abuse that they're experiencing, for sure, but also to see other aspects of their life that are important to them and that may also be posing risks to them in the same ways that a violence and abuse might. We want to see the strengths they bring to how they make decisions. We want to see the ways in which they are resilient in the face of violence, abuse, and other experiences in their lives. We want to understand the role that faith plays in their life and their decision making. We want to understand the resources that they have to help them deal with things like violence and abuse, the social networks they have, the family and friends. We also want to understand their hopes and their fears. Again, hopes and fears that relate directly to the violence and abuse they're experiencing, but also in other areas of their lives. Our job as advocates is to listen carefully, to build respectful relationships, but it's not a passive role. We have a lot of information as advocates about how things actually work on the ground, when things work the way they're supposed to, the way they're promised to, and when they don't. And that information is very valuable to inform a survivor who, again, brings a lot of knowledge about their own life, what they want to have happen. We can inform the decision making that is theirs with all the information that we have. So it's a partnership. It's a partnership where we're playing an active role in providing support.
Amy E. Judy, Senior Program Associate, Center on Victimization and Safety, Vera Institute of Justice.
It means figuring out with that one person sitting in front of you or that you're talking with on the telephone, why is it that they're calling? What specifically are they interested in and needing? And then the canvas begins to fill up. So even though I might have tools and ideas and strategies that I've used with other victims, I can't presume that all of those are what this person needs and wants. So my job as an advocate in being victim-centered is to really sit back and listen and learn and then figure out with that person what is it they need and how can I best support what it is that they want to have happen in their lives.
Alice Ghareib, Director, Doves Program, Area Agency on Aging, Region 1, Arizona.
It means letting the victim take control of the situation. It means learning and listening to what it is she wants or he wants. And then our role as an advocate is to help support that victim achieve what they want. It is not our place to tell them what to do. In addition to supporting, a part of the support includes, first and foremost to me, safety planning. But it's safety planning done together. He or she, once again, is the leader of that safety plan because nobody knows their abuser better than they do. And also our role as an advocate should be to provide resources. And in this case, in working with older victims, age-appropriate resources.
LaTrice Hogan, Consultant, formerly Director, Milwaukee Women's Center.
Victim-defined advocacy means the victim is leading the process. They're the navigator. They facilitate the course. Essentially, we're asking them what it is that they need. How can I help you? What do you need? And really, how do you need it? Oftentimes in our field, we know the answer. We have the solution. We've done this before. We have years of experience. We have years of experience, but we do not have this story. And the story is what's unique. You're leaning on the individual and the strength in their story, what they want, what's worked in the past for them, where were their struggles. And you have to lean on them because we have to remember that all service providers haven't provided service in a proficient or respectful way. So sometimes we're guiding them through a process that many of them have been through before, so they can tell you what works, what doesn't work, what I'm willing to do, what I'm not willing to do, what I'm comfortable with, where I want to receive services, from whom I want to receive those services from, and at what time, what day, what is it that I would need when you're providing those services. And that's significant, and all you do is ask the question, because when it's victim-centered, it's in their words and it's on their terms.
Logos appear. NCALL, www.ncall.us. Terra Nova Films, terranova.org. Funded by the U.S. Department of Justice, Office on Violence Against Women and Elder Justice Initiative. www.justice.gov/elderjustice. A disclaimer. This project was supported by grant number 2014 AXTA K050, awarded by the Office on Violence Against Women and by the Elder Justice Initiative, U.S. Department of Justice. The opinions, findings, conclusions, and recommendations expressed in this program are those of the authors and do not necessarily reflect the views of the Department of Justice, Office on Violence Against Women, or the Elder Justice Initiative.